yeah, all that stuff. But we're going to talk about sort of common injuries, like how we can prevent injuries, how to be active, how to be safely active, and hopefully also cover, I have a whole bunch of slides on like individual things that are common for what we call weekend warriors, and so we'll kind of go through all that. And interactive, if there are questions, I have it set up to take them at the end, but if you have something that's relevant, just raise your hand and we'll go for it, okay? So, we're going to talk about, like I said, exercise guidelines, common injuries, general treatment principles, sort of when should you go see a doctor, when should you come see someone like me. Like she said, I do sports medicine. I'm not a surgeon, although I work in an orthopedics office, so I kind of do all this crossover stuff. I do all non-operative treatment, and then the cool thing about what I do also is that I can kind of, if you do need surgery on something, I know what those things are and who to get you to best do that surgery quickest and best and everything like that. So. Injury prevention, specific injuries and treatments, so common things that you'll see in people like most of us who don't have time to exercise every single day but want to stay active and things like that. And sort of some advanced treatment options, some of the buzzwords that are out there these days on treatment for different injuries. So, I was going to say, we want you to look like these people, not like this guy when you're exercising. So who's a weekend warrior? So the Webster dictionary definition is a person who participates in a usually physically strenuous activity only on weekends or part-time. Read the little Urban Dictionary definition. I just thought it was funny. And then basically a weekend warrior is most of us, right? I mean, does anybody here exercise literally every single day? I don't have time to, but I try to exercise when I can. So a weekend warrior is most of us who work, who have lives and also want to stay active. So activity guidelines. ACSM stands for the American College of Sports Medicine, an association of trainers, doctors, and all of that stuff. So they have actual guidelines for physical activity. Bottom line is move more, sit less. Anything is better than nothing, but they recommend currently about 150 to 300 minutes, that's 2.5 to 5 hours a week of moderate intensity, or 75 to 150 minutes, which is an hour and 15 to 2 hours and 30 minutes a week of vigorous intensity aerobic physical activity. That's aerobic activity, and then they also recommend strengthening activity. So it's a mixed cardiovascular and resistance training program that they recommend. That's been shown to give you the best results and prevent the most injuries, and also be best for like your metabolism and things like that as well. And to maintain muscle mass as we age, as well as maintain fitness. So these actually are available on like the ACSM's website and online if you look up sort of their ACSM guidelines. The aerobic activity should be spread throughout the week, so you shouldn't do it all in one day. And if you can do more than 5 hours a week, there are further health benefits, but they think that that's, the 2.5 to 5 hours is what's really needed to give you some health benefit. And then the strengthening activities that we already talked about. So who gets hurt? So these pictures are meant to show that everyone does. So again, we don't want you to be this guy after your weekend softball game. We want you to stay healthy. So predisposing factors to injury, what makes us get hurt? So poor preparation or a poor fitness base. Intermittent participation, so if we're not working out on a regular basis, if we're just trying to stop and start and go all or nothing. Older age, increased weight, I put BMI in there, which is sort of a measure of weight versus height. And medical comorbidities. So that means basically other medical conditions that we have at any point in our lives. So we don't want you to do super high risk activities, and we don't want you to be the guy who's all out of shape. So high-risk activities, these are some of the ones that are most common in the literature as being high risk for weekend warriors. This is not just like younger people playing sports, this is all ages doing like weekend activities or recreational activities. But these kind of sports and activities, basketball, cycling, tennis, soccer, golf, skiing, football, yes, that includes flag football, and running. I also think that softball should be on this list, because I don't know if any of you have played on an adult softball league, but it's like a full contact sport, so we'll see. So this is just a list of common injuries. I will be going through a lot of these later specifically, but if you guys look at this list, I mean, let me see a show of hands. Does anybody see anything on here that they may have had before? So like every single person in the room. So we can tell these are sort of relevant to general population as far as injuries. So we'll talk some more about treatments, specific treatments later. Right now we're going to go over some other general principles for injury treatment. So for a lot of those common injuries that you saw, there are certain unifying treatment principles that we follow. And so that's what we're going to talk about in these few slides. So therapy, exercise. So exercise is like actually the mainstay of treating a lot of these injuries, but it has to be the right type of exercise. So most of you guys have heard of physical therapy. Yes, we have physical therapists with us tonight too, so that's good. So physical therapy I use a lot, but you don't just go to physical therapy and be like, hey, I've got pain. I try to help direct and help the therapists with what your exact injury is, what you should be doing, and to help get better. And then they do a lot as well to help. So they have a lot of different techniques that can be used. In addition to just stretching and strengthening exercises, they also have multiple what we call modalities. So I put some pictures in here of some of the buzzwords that are around these days. So this is something called Graston technique, which is almost like a massage technique, just to kind of simplify it, where it helps really with what we call myofascial pain, and it helps with releasing like tightness throughout your body and that type of thing. And so this is just an example. We always say, people come back and they say, hey, I got the butter knives. And so it kind of, some of the tools look like butter knives that they use, and it's sort of almost like a deep tissue massage technique. This is called kinesiotaping, and it can help with muscle memory, the way that muscles contract, and the way that muscles work. And it is a technique that can help, as you're recovering, help re-engage muscles in the right order and fashion as you're recovering from injury, or just to give you a little bit of support as you are playing. It is not a brace or a rigid support, but it is a functional help for your muscles to help them contract in the proper fashion. But it can be used all over the body. That's just an example on the shoulder. Foam rolling, I don't know if any of you guys have heard of that. Can also be really beneficial on especially things like backs, hips, legs. I mean, you can do it anywhere on the body, but those are some of the areas that it can be most beneficial. And then dry needling. Have any of you guys heard of dry needling? Okay, cool. So this is what dry needling kind of looks like. That's on the back. It's similar to acupuncture in the way that it looks, but it's targeting different points. Acupuncture targets meridian points. Dry needling targets muscle spasms to help restore normal blood flow and relieve spasmed muscles. So it can be very beneficial. I've had a lot of patients really like it. I've had it myself, that it can really help with injury recovery and that type of thing. So I think we covered most of these. Some other things like modalities, electronic stimulation, ultrasound can be used as well. And all of these things are included in physical therapy. It's not just strengthening and stretching. So yes, you need to learn some exercises. Yes, they can do all that stuff, but there's also all of these other tools that they can use to help you get better. So again, exercise. So ergonomic adjustments. Who wants this workplace? I do. Ergonomic adjustments can come in many forms. So it can be workplace adjustments that can help you recover from injuries that you've had, whether it's playing sports or doing other activities. And so this is actually a more common way to do an ergonomic adjustment for the workplace, where you have your screen at eye level, keyboard, he's ergonomically positioned with a 90 degree here, 90 degree here. And so I can order these things for the workplace and stuff like that as well. This is also another ergonomic adjustment to the workplace. Like I said, I want that to be the workplace. But you can also do things like a gait analysis. At physical therapy, we can order this as well. So as you're recovering or trying to get back into activities, we can look at the way that you walk and run and try to help fix some deficiencies in there, and it helps us identify things that need to be strengthened as well. And weightlifting forms. So remember, we talked about resistance training and activities. It doesn't mean you have to do powerlifting, okay? But having proper form when you're doing any sort of what we call plyometric activity or strengthening activity is really important to help prevent and avoid injuries. So more exercise, just a little bit more. Another thing that us docs can do is write an exercise prescription. So I like people to exercise. We want people to exercise. So we can actually give you like a prescription to exercise. It is possible. It can be done. And it sort of includes the method or type of exercise, the duration or amount of time, the frequency, the intensity, and then when to follow up. So this is a very individualized thing. And I do it for some people. Mainly we talk about what types of exercise are going to be best for them and their plans. So after exercise therapy, I think about things like bracing in treatment of injuries. So bracing can mean a lot of different things. It can be rigid, more like a cast, like this is called an exos. We mold it to you, and it can be used to treat fractures and things like that. Versus like a boot, which is used obviously on a lower extremity, but is removable, so it's can be a little bit more convenient for people. A controlled motion, which is like this ASO ankle brace, which gives you support but allows you to continue to move, or this knee brace, which is called like a hinge knee sleeve, which also gives you some pseudo-rigid support but still allows you motion. There's multiple other types of splints and casts and braces. We're not going to go through all of them, but this just gives you an idea of the range of things that can happen, all the way from rigid cast to kinesio tape, which we saw on the other slide. So after bracing and that type of thing, do we need any medications? I'm not a big pill pusher. A lot of people aren't big pill takers. However, they can be helpful to recover from injury. The ones we use most commonly, and some of the ones that I use most commonly, I've shown here, are Tylenol. Okay, it's one of the safest around. It is a pain reliever. NSAIDs, has anybody heard that term before? Yeah, okay. So NSAIDs, including non-steroidal anti-inflammatory medications, including Motrin or Advil, Aleve. There are so many of them. There's no way I could tell all of them tonight, but finding the one that's right for you can be helpful if you're allowed to take them. If you're not, because of medical reasons, then I do use a lot of Voltaren gel, which is a topical anti-inflammatory that can be helpful for people, and lidocaine patches. These used to be only available by prescription. They're now available over the counter, and I love using them because they're very low risk. They can give people pain relief, and it's safe, and you can get them over the counter now and use them to help with different injuries and recovery. Other medications that I use, so NSAIDs, topicals, these also BioFreeze and Blue Emu are over the counter. And occasionally we will use steroids in the case, I think we had mentioned a slipped disc before. So sometimes in those cases we will use things like steroids or some other type of things like muscle relaxers and other pain relieving medications. So when they're needed, they should be used. So we did exercise, we did bracing, we did medications. So injections are another way that we can help recover from some of these common injuries like the tendonitis or arthritis and that type of thing that we'll go over in a little bit. But injections, there are different kinds. There are steroid injections, which most people are probably familiar with or have heard of, like a cortisone shot, right? There are also something called viscosupplementation, which I have pictured here. The rooster cone shots or the gel shots for knees for arthritis. That's what those are. Toradol is a liquid anti-inflammatory that we use sometimes in joints to help with pain and inflammation. Or we use it and we can put it kind of like one of the muscle shots in the butt to help with whole body pain. And then ultrasound guidance. So I don't know if any of you guys have heard of ultrasound guided injections, but I do these, and a lot of us sports medicine docs now are doing them because the studies have shown that using ultrasound to guide injections like this, now these have been drawn over, but this is an ultrasound picture of a hip with a needle coming in to give a hip injection. And basically the literature has shown that it improves accuracy and efficacy, meaning how well the shot works, that it is and can be very cost effective, and that it's convenient because we can have it in our offices. It's not harmful to the patients, and it allows us to do things like hip injections without bringing you to a procedure suite. So I do these regularly in my office. So injections can also be used to help recover from these injuries. Now, who's heard all the buzz about stem cells, PRP, all that stuff? Has anybody heard of that stuff? Yeah, I'm seeing a lot of nodding heads. Okay, so I do that as well, and that can be used, and I wanted to bring it up because it's very relevant for things especially like the tendonitis, tennis elbow, golfer's elbow, shoulder, partial rotator cuff tears, the knee, arthritis, that type of thing. So again, too many conditions to list them all, but regenerative injections, or what are called biologics now, can be a very effective treatment. The downside is that they're expensive because insurance is not at this point in time covering them. What they do is improve the healing environment of injured muscles, tendons, and joints. They bring growth factors and healing factors into the area of injury, and different ones are used for different purposes. PRP, which I have listed here, platelet-rich plasma. We draw your blood, we spin it down, we get the platelet-rich plasma layer of blood, we inject it into the injured, typically tendon or muscle, or arthritic joint, and it helps with actual healing. It restarts the healing process and allows that to happen that has failed previously. Amniotic tissue. This is a kind of a in-betweener. It's not quite full-on stem cells, but it's not just PRP. It comes from moms who have had C-sections, who have donated fluid and tissue from, the amnion from inside before the baby comes out. So they've donated that. They've been screened, and so everything's always logged and cataloged and everything. But that has a lot of growth factors, a lot of healing factors, and some people advertise it as stem cells. There's a debate as to whether or not that should be done, but it does definitely fall into this regenerative medicine category. And then the full-on stem cells can come from two sources in our own bodies. BMAC is bone marrow aspirate from concentrate. We get it typically from the iliac crest in our hips. And literally it's from bone marrow. We have kits that process it to spin down and get what we call stem cells that have the potential to grow into other types of cells, and that can help do things like, that's where you'll see the literature about regrowing cartilage and things like that. Have they shown that it literally regrows perfect cartilage? No, but it can help things heal very well when surgery is not an option, when surgery isn't wanted, and when you want to try something that's minimally invasive, that doesn't have a lot of high-risk side effects. The stem cells can also come from adipose tissue, which is fat. So we can harvest it from fat cells as well, which a lot of people like. So that's a little bit on the regenerative injections and biologics, because it's kind of all the buzz in the news these days. But yes, we do these. Yes, they can have a role in treating, especially some of these chronic, what we call tendinopathies or chronic tendinitis conditions that we'll talk about too. So when to see a doctor? I'm hoping some of these are obvious, but if they're like lots of blood, open bone, that type of thing, you should probably be headed to a doctor. Loss of consciousness, maybe to an emergency room. If you can't walk, grip, or bear weight. So we have rules, things like for the ankle and the foot, if you can't take 3 steps, okay, that type of thing. It might be a good idea to go ahead and see a doctor. If you have severe or immediate swelling and bruising, that's an indication that something bad is going on underneath and that something else worse could result. So it's probably a good thing to see a doctor. Paresthesias means the tingling, numbness. So if you have an injury, if you get a cut or if you get hit somewhere, it's not necessarily normal to have lots of tingling and numbness. It can mean that you've injured a nerve or that there's so much pressure in that area that it is injuring the nerve, and so that's a reason to go see a doctor. Weakness, like I said, inability to grip or inability to lift your leg or your foot or something like that. Persistent pain or symptoms for 2 or 3 days. If you do something, sprain your ankle, but it's still really hurting, tender on the bone, having trouble dealing with it 2-3 days later, probably worth getting it checked out. You might have a little fracture, the sprain could be worse and need a little more treatment so that it gets better quicker. So those are sort of some criteria. Or if it's unresponsive to rice. Does anybody want to know what rice means?
Rest, ice.
Compression and? Perfect, awesome. So we still use this, okay? So if you hurt yourself, yes, rice is a pretty good adage for just about everything. So although we may not talk about this on every single slide tonight, it's definitely there, okay? So it works for most things. That's why it's there. Do it. All right, so injury prevention. So what can we do to prevent these injuries from happening? More regular workouts. So try to aim for like every other day. I mean, every day is wonderful, but most of us can't achieve that. Every other day, not just on the weekends. The guidelines that we talked about previously, 150 to 300 minutes a week, and then the 2 days of strength training. Dynamic warm-up. So have any of you guys heard of this term before? Yeah, a couple people, but not most. So dynamic warm-up. They did a bunch of studies back in the 80s being like, well, hey, should we all stretch before we exercise? So everybody would go out to the field and, sit in their little circle and put their leg out and stretch down their hamstring. Well, they did a bunch of studies back in the 80s, and they said, that's crap. Don't do it. It didn't really show that it helped prevent injuries or do anything super beneficial for people. Okay? But they said, well, what if we don't just go out there, sit in our little circle, gossip, and just stick our legs out? What else can we do? So they developed these things called dynamic warm-ups. You see people who are runners, who do track and field and stuff like that. You've seen them doing these for a while. Well, the military, a lot of the professional sports around, and FIFA, which is the national soccer governing body, have all gotten on board and said, hey, this dynamic warm-up, which is basically stretching that involves movement and elevated heart rate. So it's different activities like what you see here. So things like high knees, things like active lunges, leg swings, and some different activities here can actually help prevent injuries from happening if you do them. It's been shown to be effective doing it 20 minutes before a workout or a vigorous workout, even 2 to 3 days a week. And so a lot of the professional leagues in Europe and a lot of the soccer teams, I'm a big soccer person, so this is why I'm using this as an example, but there are workouts that have been adopted that they all do in all of the professional sports teams now to help prevent things like ACL tears and stuff, because it's actually been shown in studies to do that. So dynamic warm-up is a kind of big one, and it's something that's pretty easy to do for most people. And then set realistic goals. So most of us are not the athletes that we were a few years back, but that's okay. We can set new goals for ourselves. We can still be competitive. We can still enjoy doing exercise. We just have to be able to build a fitness base, work our way up in our training. In general, you don't want to increase your training load more than about 10% per week. So that's something you can kind of go on as far as how much more should you be doing, how much more intense, okay? And don't do too much too fast. So don't just jump in and think you're going to play at the same level you did 15 years ago. Kind of work your way in, see what you can do, see what you're capable of, and set new goals for yourself. These things have all been shown to help prevent injuries. A couple other things that are a little bit different. Mix it up. So I don't know if any of you guys have heard about sport specialization in our youth. Yes, no, maybe. So there's been a whole lot going on recently with kids that can apply to adults as well, where our kids are starting to specialize in sports when they're 5 years old, 6 years old. We're trying to have them out there practicing 5 days a week. It has been shown that that's actually not good for them. Seems like common sense, but when you get kids out there on the field and parents involved, somehow common sense tends to go out the window. But mix it up. So variable workouts, variable sports. So if you like walking, great. But it doesn't need to be the only thing that you do for exercise, okay? So mix it up. Bike sometimes, get in the pool sometimes, do some resistance training sometimes, okay? Or if you like to play, I'll use soccer again, or softball, or anything, just mix it up a little bit. If you like to just go out and do, I think somebody said kids were at ballet or doing something else tonight, do some dance, okay? Do other things, but cross-train, mix it up. Listen to your body. So how many people like to get a little competitive sometimes? But listen to your body. And if no pain, no gain, it's not always the answer, even though we want it to be sometimes. But proper hydration and nutrition, so obviously water. And is everybody aware that the nutrition guidelines have changed? This has happened over, I think, about the last 5 years or so, that we no longer have a food pyramid, we have a plate. So this is the food plate. So proper nutrition does help prevent injuries. And proper equipment. So I just have this here as an example. I like Brooks running shoes. There are certain brands that I recommend to people when they're recovering for injuries. And so proper equipment, for instance, running shoes need to be replaced about every 300 to 500 miles, or at least once, preferably every 6 months to a year. So we've kind of gone through all the general principles. Now we've got some individual injuries. If there's any that you guys have specific questions on at this point, let me know. So ankle sprains. So let's see. So the most common way to sprain your ankle is doing what we call an inversion injury, where you literally turn your foot in. which is right here, if you can see it. Okay, oh no, sorry, that's out. So right here, if you can see it, the big toe turning your foot in like this. So inversion ankle sprains sprain what's called the ATFL ligament, most commonly right here. Involve the CFL ligament or the PTFL ligament right there. There's many different types of ankle sprains. This is the most common. Less common is the eversion ankle sprain where your foot turns out, which is this here. Okay, and that is a higher risk sprain. So not all sprains are created equal. If you get an ankle sprain and people are like, oh, it's just a sprain, but it keeps bothering you or you have tenderness over the bones, see a doctor because you may need some additional treatment. The worst thing that people do with ankle sprains is to not treat them, to be like, oh, it's just an ankle sprain. Because then it doesn't heal properly, you don't get your strength back, and you do it over and over again, and then it gets worse. So I hate it when people come and they're like, oh, I just sprained it a few times. Like, yes, did you do anything to get it better? No, I didn't think I needed to. It just got better on its own. It does, but you lose what's called proprioceptive function, which is that position sense of like if you stand and close your eyes and you can kind of tell where your body is in space and balance. You lose that sense when you sprain your ankle because that sense comes from some fibers that are in these ligaments. And when those get torn or sprained, you lose a lot of that. So physical therapy and treating it properly can help you regain that. All right. Recovery, I kind of put like general recovery on a lot of these slides. Typically, yes, mild ones you can recover from quickly. Bad ankle sprains take up to 3 or 4 months to get better from. So it really can be bad. Shoulder. Who's heard of the rotator cuff? Most people, almost everybody who comes into my office about their shoulders is worried about their rotator cuff, okay? This is the rotator cuff, okay? These muscles, the supraspinatus, the infraspinatus, the subscapularis, and somewhere on here is teres minor. Should be around the back, just a little bit right back in there. So, those are the rotator cuff muscles, okay? You can tear the rotator cuff tendons and muscles as they come in and insert around the shoulder. You guys see how they kind of encapsulate the shoulder right in here, right up in here, okay? So yes, you can tear the rotator cuff. That can be a big injury to the shoulder. You can tear what's called the labrum cartilage, which is right here, which is actually the cartilage around the socket part of the ball and socket, okay? And these are common injuries that happen to us weekend warriors, okay? You can have a shoulder separation. Has anybody heard of that before? People say, oh, I got my shoulder out of joint. It doesn't necessarily mean they dislocated it. They say, I separated my shoulder. It's actually talking about the acromioclavicular joint right up here, okay? And these ligaments that are involved in it, okay? A dislocation is when you actually dislocate the glenohumeral joint, the actual shoulder comes out of place, okay? So those can also happen. Bursitis and tendonitis. So I have this picture here to show a bursa sac, which is right up here that sits right on top of the rotator cuff tendons. So oftentimes when people have pain, they've hit their shoulder or they've sprained their shoulder, they have a bursitis or a tendonitis, not so much a huge tear. But you know, we can help differentiate that and treat it appropriately. So treatment for these, again, recovery is very variable. It depends on what you've done, but anywhere from a few weeks to a year or more, okay, depending on how bad the injury is and what it is. Treatment, all the normal stuff, okay? All the stuff we previously talked about, physical therapy, sometimes a sling, sometimes an injection, and then sometimes surgery. Sometimes the rotator cuff does need surgery, okay? Sometimes shoulders do need to be what we call decompressed. Sometimes there are fixes for arthritis that occurs in the joint up here, okay? So common injuries in the knee. So knees are another big hot topic issue. So has anybody heard of the ACL? The MCL, which is right here. The ACL is right here in the middle of the knee, and the LCL, the lateral collateral ligament, is on the outside of the knee, okay? So you can tear or sprain any of those ligaments, okay? And MCL and LCL will heal. ACL will not heal, okay? ACL reconstructions that we used to only do on kids and like professional athletes, no more. People who are my age, in their 40s, in their 50s, Once we get into our 60s, 70s, and beyond, a lot of times we're starting to have arthritis, so not as many people have their ACLs reconstructed at that age, but ACL reconstruction is done in a lot of people now. It's not good to walk around without an ACL because it prevents you from doing twisting, turning activities. So there are certain things that need surgery in the knee. ACL tears are typically one of them. A bucket handle tear of the meniscus. Are you guys familiar with the meniscus, which is this cushioning cartilage in between the bones? There are certain types of tears of the meniscus that need surgery because they will prevent your knee from moving right and they will just make things worse. So some of them need them, not all of them. So, you know, there are different ways we can do things like MRIs and stuff like that to help determine what it needs, okay? But if you have a swollen knee that happened after an injury, especially if you twisted it or came down on it or something happened, and it's swollen and it's not going down, come in, we'll check it out. We'll get you going on, you know, on treatment and evaluation, okay? Again, recovery is very variable based on what you've done. If you have a minor sprain of your MCL ligament, you can recover in about 2 to 4 weeks, okay? If you have an ACL tear and have to have it reconstructed, it's going to take you about a year or more to get back from that, okay? We can use all sorts of things, physical therapy, medications, bracing. You saw the knee brace, the hinge knee sleeve. That's a very common one that we use. Or the big ACL braces that some of the professional football players wear. Some things like that. We have all sorts of braces. Injections, we do use this a lot. And arthritis is a different slide, but we do use injections a good amount in the knee. Steroids, the viscosupplementation, the gel shots that we talked a little bit about, the regenerative injections, the biologics, and then surgery in certain cases. Muscle strains. So I would venture that most people have had one of these at some point in your life. So common areas are the hamstring, quadriceps, groin, calf. Okay, I just put a few pictures in here about hamstring, calf, and something called a sports hernia or groin strains. So these can take a while to heal. All right, people sprain their hamstrings and they want to go back tomorrow. And I'm like, all right, got to give this a little time. And we got to offload it. These are where physical therapy comes in big time for recovery. So you need to exercise right. It doesn't mean you have to completely stop moving, but we need to get you doing the right type of exercise, because if you just go out and start running again or try to just go out and start your normal activities, it's just going to stay there. It's just not going to go away fast. Hamstrings especially, and a lot of these we do what's called eccentric exercises, which means active lengthening of a muscle. So for instance, if you go up on your toes and you very slowly lower yourself down on a step or a curb or something like that, that's called an eccentric exercise. And so we use a lot of these to help people recover from muscle strains in these different areas. All of the normals, you're going to see these over and over again. Kinesiotaping can also be really helpful in muscle recovery because, it helps with that muscle contraction and muscle memory. Bracing, compression sleeve. You guys ever seen anybody wear one of those compression sleeves around like their hamstring or their thigh? Those can actually be very helpful for hamstring or quadricep injuries, and for calf injuries as well. Dry needling with physical therapy as well. And then the regenerative injections can play a role also.